We understood how needles relax muscles and resolve pain. Now let's use this principle to understand how the application of needles to the muscles affects the brain, even changing our mood. Think about the main reaction when a worried person's face. The frown, the crinkle between the eyes. This frontal muscle contraction reaction is natural in a person with worry or on their mind. Or another similar feeling, as natural as rising the corner of our lips when we feel sensation of joy. Also think about headaches, migraines, which affect the temporal region of the skull or the back of the neck. These are pains that most commonly originate from intracranial pressure and are reflected in the muscles surrounding the skull. Anxiety, depression, insomnia. Feelings such as worry, anxiety are purely abstractions of the mind, but they manifest themselves concretely by causing the contraction of certain muscles. In the case, the muscle that contracts between the eyes and frowns. This stimulus is two-way street. Worries make certain muscles contract. Relaxing these muscles brings relief from worries. Migraines makes certain muscles contract. Relaxing these muscles brings relief from migraines. It's not surprising that the most famous and classic acupuncture point for anxiety is the yin tongue, which is located between the eyebrows. This effect is known as face feedback, discovered by scientists who evaluated whether forcing a smile could bring a feeling of happiness. And yes, the results were positive. When we force a smile, we are stimulating our muscles in a way that they would be stimulated when we feel happiness. Just as the sensation of pleasure generates a stimulus in the brain and certain muscles of the face, stimulating this muscle will voluntary forced contraction generates a sensation of pleasure in the brain. For the same reason, it is extremely efficient to treat headaches and migraines by needling the points on the head where the patient reports feeling more pressure. A migraine causes certain muscles in the skull to contract. When we relax these muscles through the needles, we are taking information contrary to the migraine to the brain and relieving it. This face feedback feature allows us to treat the most diverse psycho problems that reflect muscle contraction. In addition to anxiety that naturally reflects in the yin tongue, other points can be used for treatment. Let's look at cases of bruxism, where there is involuntary contraction of the masseter during sleep. It's a condition that is fully treatable by inserting needles into the masseter muscle and relaxing it, resulting in psychic relaxation related to the cause of bruxism. As an advice from someone who is learned through practice, I always advise, in cases of anxiety, depression, migraines, dizziness, insert needles into the back of the neck in the Feng Fu or Feng Shi points, beyond yin tongue, or the Ashi points indicated by the patients. What about the famous lump in the throat when anxiety tightens? So here's another tip for the point to be needled. Shui2 point lateral to the glottis in addition, of course, to stimulate that resolve anxiety and which coincidentally are linked to the swallowing muscles. Needles close to the swallowing muscles help with relaxation, while needles in the auricular branch of the vagus nerve have a direct effect on the parasympathetic system. We will talk about this point soon. And it's worth a reminder, when we talk about treating anxiety, it's also applied to all conditions with psycho origin, such as insomnia, depression, stress, hyperactivity, etc. The treatment for all these conditions will involve stimulating the parasympathetic system and bringing psychic relaxation. We are talking about psychological conditions. So let's go into the golden treatment of acupuncture.